Broken heart syndrome is killing men at more than twice the rate of women, according to a new study from the University of Arizona. The condition, called Takotsubo Cardiomyopathy, or TC, is triggered by extreme physical or emotional stress and causes the heart muscle to suddenly weaken. Researchers looked at nearly 200,000 patients in the United States and found that while more women get TC, men are much more likely to die from it. About 11% of men with TC died, compared to 5.5% of women. The study suggests that men often develop TC after physical stress, like surgery or infection, which may make it more dangerous. Hormonal differences might also be a factor. The condition is often mistaken for a heart attack because the symptoms are very similar, which can lead to delays in proper treatment. Serious problems like heart failure, stroke, and irregular heartbeat were common in TC patients. Doctors say early diagnosis and the use of blood thinners in high-risk cases could help lower the risk. Broken heart syndrome is often linked to emotional events like the death of a loved one or a breakup, but it can also be triggered by many other types of stress. Physical causes include surgery, serious illness, infections, or even intense physical exertion. Sudden shocks, like a car accident, receiving bad news, or even extreme fear, can also set it off. In rare cases, positive stress, like winning the lottery, a surprise party, or an unexpected promotion, can also trigger broken heart syndrome. This response, sometimes called happy heart syndrome, shows that the heart can react strongly, not just to grief or fear, but to any sudden emotional shock, whether good or bad. Certain medications or drug use have also been reported as possible causes. Humans emit visible light that vanishes when we die, according to a new study by researchers from the University of Calgary and the National Research Council of Canada. They found that living things, including humans, release an extremely faint light called ultra-weak photon emission. This glow, invisible to the naked eye, appears to come from stress reactions in cells and stops when the organism dies. Using sensitive cameras, researchers measured this light in live and dead mice. In each case, there was a clear drop in light after death. To rule out heat as a factor, they kept the mice warm even after euthanasia. They also tested leaves from two plant species, Thale cress and dwarf umbrella tree, and found that damaged parts of the leaves gave off more light than healthy parts, further linking the glow to cell stress. This glow is likely caused by reactive oxygen species, which are chemicals cells produce when under pressure from things like heat, toxins, or injury. These chemicals can trigger reactions in cell materials like fats and proteins that release tiny bursts of light. While this idea has been around for decades, it's often dismissed as fringe science. But this new experiment shows clear evidence that ultra-weak photon emission exists and disappears at death. This finding could have practical use in medicine or agriculture, offering a new way to monitor health or stress in tissues without surgery or invasive tests. The study doesn't prove we have glowing auras, but it does confirm that living cells emit a real, detectable light, and that light fades when life ends. Happy heart syndrome is a rare but medically recognized form of broken heart syndrome, also known as Takotsubo Cardiomyopathy, where intense positive emotions, rather than grief or trauma, trigger a sudden weakening of the heart muscle. While the more familiar version of the condition is typically linked to events like the loss of a loved one, serious illness, or physical injury, happy heart syndrome can be set off by joyful experiences such as winning the lottery, attending a surprise party, hearing unexpected good news, or even celebrating a long-awaited achievement. In these cases, the body still reacts with a surge of stress hormones like adrenaline, which can temporarily stun the heart, leading to symptoms that closely mimic a heart attack. These include chest pain, shortness of breath, abnormal ECG results, and elevated cardiac enzymes, often leading to hospitalization and further testing before the true cause is identified. Like other forms of Takotsubo cardiomyopathy, happy heart syndrome typically does not involve blocked coronary arteries, and most patients recover with supportive care over days or weeks. However, it can still lead to serious complications such as heart failure, arrhythmias, or even, in rare cases, death, especially in older adults or those with underlying health issues. The condition is more frequently diagnosed in women, particularly those over the age of 50, though it can affect anyone. Because happy heart syndrome is uncommon and counterintuitive, it may go undiagnosed or be mistaken for other cardiac conditions, especially if clinicians don't suspect a positive event as the trigger.